I know you had mentioned that you have a grant, or your hospital has a grant, I believe, from NIH to study children who have had COVID and watch them see what symptoms develop or what the effects are. Can you tell me a little bit more about that and what your takeaways are so far?
Sure. One of the big uncertainties, because we'd never faced a pandemic that was based on the coronavirus, and there was so much unknown about its impact on children. I mean, I remember back when it first was coming along, people were saying, well, children are not affected. Well, we've learned the hard way that that's not true. So what we wanted to do, because we at Children's National and other pediatric hospitals were seeing the impact on children, we wanted to follow the natural history. So that meant taking several thousand children that were positive for the virus and following them along and looking at, did other diseases develop, mental health issues, what the natural history of this was long. And so we're doing that in conjunction with the NIH. We have a multidisciplinary clinic where we look at all the different organ systems that are affected, whether it's the heart, the brain. It's a comprehensive look at things. And then we'll follow that along for 3 or 4 years to see what are we seeing? Are we seeing things new? There's long COVID that a lot of people are worried about. What does that mean? How does it show up? And there's some other things that we're seeing. The incidence of diabetes, I know we were talking before, has risen. Nobody expected that. So we're seeing not only more cases of diabetes, we believe that the virus is attacking the islet cells of the pancreas that's causing that through an immune thing. But we've also seen a really tremendous rise in the number of type 2 diabetes. And we're thinking that that relates to children not getting as much exercise, maybe gaining weight. And we're seeing that earlier and much more severe.